Hi, I'm David Coram. Welcome to Mariana's Eye Institute. I want to talk a little bit today about the drug Avastin, which may be recommended for use inside the eye. Avastin is a drug that it was formulated to treat colon cancer and is FDA approved for colon cancer. However, the FDA allows us to use it inside the eye, even though it's not FDA approved for use inside the eye. We've been using Avastin inside the eye for about 10 years, and we've had very good results. In fact, it's the most commonly used injection in the eye in the world. There are a few things to know about the options to Avastin. There are drugs that are FDA approved for use inside the eye. The challenge with those drugs are they're very expensive. They're about $2,000 per injection, which is 10 to 20 times more expensive than Avastin. Sometimes we do recommend those drugs. If someone doesn't have success with Avastin, then we may recommend moving to one of those drugs that are FDA approved and more expensive. Another difference between the two drugs is that Avastin is formulated in a pharmacy, whereas the drugs that are FDA approved are formulated in the laboratory by the company that makes the drugs. So Avastin, there have been a few reports some years back of a batch of Avastin getting contaminated in a pharmacy and causing visual loss, infection, and blindness in large numbers of patients from a single batch. There was a lot of work that was done to try to prevent that from occurring, and it's been some years since that has occurred. Again, it's something uncommon, but I feel it's my responsibility to just clearly spell out the differences between Avastin and the other drug options. So those two main differences are the FDA approved drug is much more expensive. Avastin is formulated in a pharmacy, and there have been some cases of contamination of the drug in the pharmacy. So the other thing is that we use Avastin to treat the growth of new blood vessels or leaking blood vessels inside the eye. And these are most commonly, the diseases that cause these most commonly are diabetes, macular degeneration, and a variety of different vascular diseases or diseases with blood vessels inside the eyes. Finally, the thing I say is that anytime we do anything around the eye, any injection around the eye, no matter what drug you're using, has certain risks. And the risk that we are concerned about the most is the risk of infection. Because if you develop infection inside the eye, it can result in total blindness, even loss of the eye. So it's something that I make sure people understand. Now, that kind of a complication, that kind of a risk is extremely rare, about 1 out of 1,000 cases. We do what we can to prevent it. However, sometimes it still just happens. So it's important to know that. There's about a 1 in 1,000 chance of developing an infection that could lead to blindness from the drug. Finally, I tell my patients, I don't tell you these things to scare you. It's just my job as your doctor to make sure you understand there are some risks involved. And that's just like everything in life. Everything in life has certain risks. We use Avastin very commonly. We're happy with using it. Many, many patients get it, but it's still my job with every patient. I talk about these things with them. We'll give you a permission form. It's a very detailed form about a variety of other things concerning Avastin. And so what I'm talking with you about right now is really just hitting the high points, but please read over the form carefully and ask any questions if you have them. Thank you.